I am washing my hands. And now I'm going to go into the patient's room. Hi, I'm Grace and I'll be your nurse today. I'm closing the door for privacy. What is your name and date of birth?
Olivia Swarman, October 11th, 2002.
What's your name again?
Olivia Swarman.
Where are you?
In my house.
And what is today's date?
April 28th, 2020.
Patient is awake, alert, and oriented times free. Patient's eyes open spontaneously, responds appropriately, and obeys commands. Glasgow Coma scale is 15. Next, I'm going to check her pupils. And can you follow my finger? Patient's pupils are equal, round, reactive to light, and accommodate to distance. Can you follow my pen? Patient's extraocular muscles are intact. Can you open your mouth? Patient's mucous membrane and tongue are pink and moist with no lesions or sores present. Can you open your mouth, stick out your tongue, and say ah? Patient's uvula rises and falls symmetrically. Vagal nerve 10 is intact. Can you smile? Patient's teeth are intact. Do you have a cough or have been feeling short of breath lately?
No.
Patient denies having a cough or feeling short of breath. There are no signs of respiratory distress. Next, I'm going to take her respirations. Patient's respirations are free in 10 seconds. Patient's chest rises and falls symmetrically without the use of accessory muscles. Next, I'm going to listen to her lungs. Can you take a deep breath? You take another deep breath. Take another breath. Take another breath. Can you turn around so I can listen to your lungs in the back? Can you take a deep breath? Take a deep breath. Take a deep breath. Can you take a deep breath? Can you take a deep breath? Take one last breath. Patient's lungs are clear to auscultation and no adventitious lung sounds were heard. Next, I'm going to take her radial pulse. Patient's radial pulse is 12 and 10 seconds. And next I'm going to listen to her apical impulse. Patient's apical impulse is 12 and 10 seconds. And next I'm going to palpate the apical impulse. Patient's apical impulse is palpable. Next, I'm going to palpate her carotid arteries. Can you please look this way? Can you look this way? Patient's carotid arteries are palpable. Next, I'm going to listen to them with the bell of the stethoscope. Can you hold your breath? You look this way and hold your breath. Patient's carotid arteries have no bruits. Next, I'm going to listen to the parts of her heart with the diaphragm of the stethoscope. I'm listening to the aortic. That's the aortic, pulmonic, tricuspid, and the mitral. Next, I'm going to listen again, but with the bell of the stethoscope. Patient's heart sounds are within defined limits and no extra heart sounds were heard. Can you please lie down so I can inspect your abdomen? So now I'm inspecting the patient's abdomen. Patient's abdomen is has no scars, lesions, or discolorations and has a flat contour. Next, I'm going to take a listen to it. Valve sounds are heard in all 4 quadrants. Next, I'm just going to do some percussion on it. Patient's abdomen has tympani in all 4 quadrants. And next, I'm just going to do some quick palpation. Do you feel any pain or discomfort?
No.
Patient's abdomen is soft and non-tender with no masses or lumps noted. And next, I'm going to palpate the liver. Patient's liver is non-palpable. Next, I am going to inspect the arms for color. Patient's arms are pink in color. You can put your shirt down. Patient's arms are warm and dry. And next I'm gonna take her radial and brachial pulses. Put them right there. Radial pulses are palpable bilaterally. Patient's brachial pulses are palpable bilaterally. Next, I'm going to test capillary refill. Capillary refill is less than 2 seconds. Next, I'm going to inspect the legs. The legs look pink in color. Patient's legs are warm and dry. There is presence of hair growth and it is within defined limits. Now I'm inspecting the legs. There are no signs of lesions, sores, or open wounds on it. And next I am going to test the capillary refill in her toes. Patient's capillary refill is less than 2 seconds. Next, I'm going to take the dorsalis pedis pulses. Patient's dorsalis pedis pulses are palpable bilaterally. Next, I'm going to do the posterior tibial pulses. Patient's posterior tibial pulses are palpable bilaterally. Next, can you please sit up? And can you face me? Can you squeeze both my hands? Patient's strength and resistance are equal bilaterally in the upper extremities. Next, can you put your legs out and point your toes up to the ceiling? And oops, I just moved the camera. Push your legs up and point your toes to the ceiling. And can you try and keep them up while I push down? Patient strength and resistance is equally bilaterally in the lower extremities.